Dr. Anju Teresa Andrews. I'm a psychologist. Today we'll be discussing about social anxiety disorder or social phobia. Many people feel slightly anxious or self-conscious when they're giving a speech, interviewed for a job or meeting someone new. But most people can get through it. But if you have social anxiety disorder, the stress of the situation is too much to handle. You try to avoid the social situation because it makes you so uncomfortable. Eventually, all aspects of your life, not just social, could start to fall apart. Social anxiety disorder is a condition which involves excessive emotional discomfort, fear, and worry about social situations. The individual worries about being negatively evaluated, scrutinized by others, and there is heightened fear of interaction with others. Social anxiety becomes a disorder when everyday social interactions cause excessive worry, anxiety, self-consciousness, and embarrassment. You try to avoid social situations or situations wherein you need to perform in front of others, and when the situation cannot be avoided, you endure it with great distress or significant discomfort. Trivial everyday activities such as filling out a form with people around, walking into a crowded room, eating in public, or starting a conversation may be highly stressful to an individual who is suffering from social anxiety disorder. The individual experiences an overwhelming fear of being judged by others, of being embarrassed or rejected or humiliated. He worries that his anxiety would be evident to others because of his sweating, trembling, and hence they would think less of him. Also, the individual might be extremely worried about unintentionally offending others. Being center of attention is a problem for an individual with social anxiety disorder. Some of the common situations which cause significant distress in social anxiety disorder are meeting strangers, meeting someone new, talking one-on-one with a new person. Could be a situation for an interview for a job, or attending social gatherings, speaking in front of others, reading or writing in front of others, performing in public, etc. All of these situations are not equally dreadful in an individual with social anxiety disorder. For example, giving a speech might be a cakewalk, but attending a party might be a nightmare. Or you would be great at one-on-one conversations, but you might get tongue-tied in a crowded room. Just because you experience anxiety or shyness occasionally in social situation does not mean that you have social anxiety disorder. Many of us experience shyness and nervousness occasionally in social situations, but it does not interfere with our day-to-day functioning. Social anxiety disorder, on the other hand, causes tremendous discomfort, and it interferes with the individual's day-to-day functioning. For example, it is perfectly normal to get slightly jittery before giving a speech. But if you spend a lot of time, weeks ahead, worrying about the speech, or call in sick to get out of it, or once you start giving this speech, you start shaking so bad that you can hardly speak, then it is social anxiety disorder. Some of the physical symptoms of social anxiety disorder are sweating, trembling, shaking, nausea, stomach disturbances, rapid heart rate, shortness of breath, dizziness, feeling as if you're out of control, out of body experiences. Behavioral symptoms are trying to avoid social situations completely, the need to take someone with you in social situations, staying quiet or hiding in background to escape notice or embarrassment, need to drink, need to have few drinks before a social situation. You may experience these symptoms immediately before a social situation, or you may start worrying about it weeks ahead of time. Or you might go for the social event, and afterwards you might spend a lot of time and energy on how you acted during that particular situation. Individual with social anxiety disorder knows that their fear, their worry is irrational and it is not needed. Nevertheless, knowing something is not the same as believing it. Social anxiety disorder usually develops during teenage years. It can be linked to a history of abuse, bullying, or teasing. Like many other mental health conditions, social anxiety disorder could also be caused by a complex interplay of biological and environmental factors. Possible causes include genetics. Anxiety disorders tend to run in families. So if your family member has social phobia, you are at an increased risk of developing it. Brain structure. It could be related to having an overactive amygdala, the part of the brain that processes your feelings of fear and anxiety. Also, environmental factors. Social anxiety disorder could be a learned behavior. For example, you might have gone through a social situation wherein you experienced humiliation or embarrassment, and it could later on contribute to the development of social anxiety disorder. Also, there could be association between social anxiety disorder and parents who either model anxious behavior in social situations, or parents who are extremely controlling or overprotective of their children. Social anxiety disorder prevents an individual from living his life to the fullest. It interferes with his work, school, relationships, and general enjoyment of life. An individual with social anxiety disorder has increased risk of developing major depressive disorder and alcohol dependency disorder. So how can we manage social anxiety disorder? Treatment options include psychotherapy, medications, or combination of both. Of all the psychotherapeutic modalities, cognitive behavior therapy has been found to work best for managing social anxiety disorder. It teaches the individual to change the way in which he thinks, feels, and behaves in social situations. Medications are used to relieve the anxiety symptoms. Medications work best when used in combination with therapy, thus addressing the root cause of social anxiety disorder. So seek help if you need it. It's okay to ask for help. Change might not happen overnight, but if you keep going at it, you will definitely succeed in changing the way in which you're feeling. Thank you.